In most situations, Medicare will not pay for healthcare or supplies you get outside the United States. The term outside the United States means anywhere other than the 50 states of the U.S., the District of Columbia, Puerto Rico, the U.S. Virgin Islands, Guam, American Samoa, and the Northern Mariana Islands. There are some exceptions that would allow you to get coverage outside the U.S. under Medicare Part A hospital insurance and/or Part B medical insurance. When does Medicare cover healthcare services in a foreign hospital? There are 3 situations when Medicare may pay for certain types of healthcare services you get in a foreign hospital, a hospital outside the U.S. First situation, you are in the U.S. when you have a medical emergency, and the foreign hospital is closer than the nearest U.S. hospital that can treat you. Second situation, you are traveling through Canada without unreasonable delay by the most direct route between Alaska and another state when a medical emergency occurs, and the Canadian hospital is closer than the nearest U.S. hospital that can treat you. Medicare determines on a case-by-case basis what qualifies as without unreasonable delay. Third situation, you live in the U.S. and the foreign hospital is closer to your home than the nearest U.S. hospital that can treat you, regardless of whether you have a medical emergency. Remember, in these situations, Medicare will only pay for the Medicare-covered services you get in a foreign hospital. What kind of healthcare services does Medicare help pay for in these 3 situations? Medicare covers these services. Part A covers inpatient hospital care. Care you get when you have been formally admitted with a doctor's order to the foreign hospital as an inpatient. Part B covers emergency and non-emergency ambulance and doctor services you get immediately before and during your covered foreign inpatient hospital stay. However, if Medicare does not cover your hospital stay, and/or you get ambulance and doctor services outside the hospital after your covered hospital stay ends, Medicare generally will not pay for these services. For example, Medicare will not cover return ambulance trips home or doctor services you get in a foreign country after your covered foreign hospital stay ends. Remember, Medicare only pays for its share of Medicare-covered services. If you only have Part A, Medicare only covers inpatient hospital care. Does Medicare pay for dialysis treatments when I travel outside the U.S.? No, unless you get dialysis during an inpatient hospital stay. Under one of the 3 situations that we previously described, Medicare does not cover dialysis when you travel outside the U.S. Does Medicare pay for prescription drugs outside the U.S.? No, Medicare drug plans cannot cover drugs you buy outside the U.S. Will Medicare pay for medically necessary healthcare services I get on a cruise ship? Medicare may cover medically necessary healthcare services you get on a cruise ship if the doctor is allowed under certain laws to provide medical services on the cruise ship. The ship is in a U.S. port or no more than 6 hours away from a U.S. port when you get the services, regardless of whether it's an emergency. Medicare does not cover healthcare services you get when the ship is more than 6 hours away from a United States port. What do I pay if I get Medicare-covered services outside the United States? Except in the limited situations described earlier, Medicare does not pay for healthcare services you get outside the U.S. If your circumstances do not meet these limited situations, you pay the full cost to the healthcare provider. If your situation matches one of the 3 situations discussed earlier and Medicare covers the items or services you get, you would pay the related coinsurance or copayments and deductibles. Although U.S. hospitals must submit claims to Medicare for you, foreign hospitals are not required to file Medicare claims. If you are admitted to a foreign hospital under one of the situations described previously, and that hospital does not submit Medicare claims for you, then you pay the full cost to the healthcare provider. You must also submit an itemized bill to Medicare for your doctor, inpatient, and ambulance services. If you got Medicare-covered services on a cruise ship under a situation previously described, the doctor must submit the Medicare claim. However, you may also file a claim directly to Medicare in these rare circumstances. For more information about what is covered by Medicare, be sure to visit Medicare.gov or call 1-800-MEDICARE, 1-800-633-4227, or TTY users can call 1-877-486-2048. Remember that knowledge is power, and we here at Social Security Secrets Revealed believe in putting that power back into your hands. If you found this video helpful and want to learn more about all things related to Social Security, please give this video a like and be sure to subscribe to Social Security Secrets Revealed.